Hello, doctors and medical students. Welcome to our second podcast, and thank you for all the support. Our doctors community creating a lot of discussion, a lot of content on academic aspects, but we are lagging behind to create discussion and content on other aspects of life as a doctor in this society. That's what exactly we are going to do in this platform. If you are not following it till now, do it right now. We are going to learn a lot from this platform. In every episode, we are going to discuss one important topic which will be very useful for the doctors. In this regard, today we are going to discuss about medical certification. Nobody can deny that medical certification is integral part of our medical practice, but many doctors do not have adequate knowledge regarding medical certification. There are so much to be discussed regarding medical certification. Many of us do not know the essentials, rules and regulations involved and do's and don'ts regarding medical certification. So I feel it is imperative to create comprehensive content on medical certification. For that, today we are with none other than Dr. T. Ravishankar, one of the leading medicolegal experts in India. Thank you. Sir, what are the common reasons people come to us for medical certification?
The general need of the public is based on two major things. One is for their ailment. They have a problem, they come to a doctor for treatment, so they need to avail a medical leave for their benefits in the workplace to continue, or if they are studying in school or college, they don't need to lose any attendance. That's the reason, the first reason they might be asking for a certificate. The next one is for their professional work or an occupation, trying to get an employment. At that point of time, they always reach a doctor to get a certificate of physical fitness or mental fitness. These are the two major places where a patient comes to a doctor to demanding a certificate. They avail a leave for the ailment they suffer. They have to be given a document by the treating doctor for what ailment, from which date to which date the individual was sick and was under treatment and needed rest for those days, and from which day the individual will be able to come back to normal work. That's a major certificate that is being issued by any medical practitioner in this country or in fact any part of the world. The next one is somebody goes for a employment for the first time, or they are getting changed in their employment, and every employer demands the certificate of physical fitness or a mental fitness. It depends on his nature of job. If it is going to be a physical work, manual labor, they might have to give a certificate that he is physically fit for it, the job. He should not be suffering from any non-communicable diseases if he is of young age, and if he is of a higher age, somebody who is 45, 50, they might ask him that he doesn't have a complications of the non-communicable disease, and that's the one major thing. Somebody is working in an IT industry, he is not supposed to have a drug which he needs to take for keeping some of his systems normal, like an epileptic patient who needs to take rest for 8 hours. He can't do a night shift. He can do a night shift at the same time. He need to compensate equally in the daytime when he has to sleep at least 8 hours. These are things demanded from people where they need to spend their brain and work for hours together thinking around, and those people, they are always asked to give a medical certificate of mental fitness and physical fitness. These are the two places where the doctors are majorly asked for to give a provider certificate. And there is another major issue is that disability certificate. That has to be provided only by the concerned specialist and not a general practitioner or a family physician, or anybody cannot provide that as such. It depends on the disability where he has got. If it is going to be an eye disability, it has to be provided by an eye specialist or an ophthalmologist. And if he has got a fracture and has got a difficulty in walking or a spine deformity, it has to be provided either by an orthopedic surgeon or a neurologist who can certify his neurological deficit. These are disability certificates. These are major places where the registered medical practitioner is being asked to provide certificates.
Okay, sir. And I think I heard some, because I also came across these kind of certificates, like they are coming for life certificate, like when they're, usually it happens when there is a property transfer, something like that. At that time, they're asking for life certificate. Is that also like, what is significance there for us?
There are two places where the life certificate is demanded. One is when there somebody is going to try to register a property to somebody to sell it or buy it, or that place they always has to give a life certificate, or the person is alive on that day. Usually somebody who's sick The registrar of the register office is asked to go to their house to register the property which is available in this country as per the constitution and the law that is prevailing in the respective states. In those places, they need to give a certificate, life certificate. The person is also disabled, cannot move out, old age person, bedridden or somebody like that. So at that point of time, they also demand a certificate. The life certificate is another place where people live for ages beyond 70, 75. They are a retired person or the spouse who's eligible to receive the retirement benefit of pension, monthly pension, and somebody who's there to get back the insurance money that he has paid. These are the situations where a life certificate is demanded by a patient from a registered medical practitioner. It's very simple. Verify the individual. Today you have your Aadhaar card. Earlier it was only the passport, and passport was not available with all the individuals in the country. Now Aadhaar card is available with every individual. Verify with your Aadhaar card, certify that person is so and so, and very important is to add the identification mark of the individual and give a certificate. Life certificate is very, very important, and that is only valid for 12 months. Usually it is valid only for 12 months. The time usually happens at the beginning of the financial year or the second half of the financial year. The institutions, the banking sectors will be demanding the life certificate, and also the workplace that provides pension for individuals also will demand a life certificate for that.
Okay. And among the certificates which you have mentioned, in your experience, which are all you think are very sensitive in terms of they have more legal liabilities?
The legal liabilities is more on the life certificate.
Okay.
There are times when we did not have the Aadhaar card.
Mm-hmm.
Hardly 10 to 20% of the population was having the passport.
Mm-hmm.
I don't think every individual is going out of the country and they were getting the passport. Today, everybody owns a passport.
Mm-hmm.
At that point of time, it was always difficult to verify the individual. There were only the ration card provided by the state government, which doesn't have the identity of the individual, and there is nowhere that the identity of the individual is being marked on the ration card. And that was a very, very sensitive issue, trying to give a life certificate. There are a number of doctors who landed up in trouble with the courts directing the medical council to take action against them for having provided a false certificate, which was not an intentional false certificate, but somehow they got entangled into such an issue, and that is where the whole problem had happened for those individuals. This is a very, very sensitive one. Even a leave certificate, somebody who demands it regularly to get away from the workplace. Today there is another issue also that they want to do work from home.
Yes,
the
I was supposed to ask that.
The work from home is another certificate which is being demanded by the IT industry. People or somebody who's working on shifts. We need to justify in some way or other whether the person needs to be exempted from a regular duty or from a shift duty, and that has to be also mentioned on a specific time. Beyond that time, I think it is unfair to get the leverage of the individual's capacity to work in an institution. So you need to be careful in providing a certificate of fitness for working in shifts and all these things.